I mentioned earlier, I also cover Pennsylvania Danville, so I work with their CSV a lot to help them with some mental health first aid and ACEs trainings. I also can do Revive trainings. We have several community health workers on my team. I have one in each district who focuses on maternal child health. Destiny Watson is our maternal child health CHW for Southside, and I know she works a lot at Tri-Counties and other organizations already. We also have two community health workers, one for each district, focusing on cardiovascular health. And so with that, we are working on putting together a group that's called the Learning Collaborative of community members who really want to work on improving heart health in their community, as well as reducing stroke risk and high blood pressure. So if anyone lives in Halifax, particularly in the northwestern corner, let me know if you want to work on that project. I'll be happy to connect you to Ish. We also have, shameless plug, I have signs, yard signs that have strokes, that are stroke smart signs and have warning signs of the strokes. So if anyone wants to put any in your organization's front lawn or anything like that, let me know. I'd be happy to get you some of those as well. Um, my population health community coordinator does a lot of work on focusing on access to healthy foods. So right now she's working with some groups in North Danville and working on getting a co-op established there, as well as looking at some different corner store initiatives. And then, of course, my team does a lot of our outreach and is responsible for a good majority of our community partnerships. We have over 100 community partners we work with. Thanks to my wonderful team, we also have what's called the ARPA TCO funding, which is we've written in there to do specific health education events, and it can pay for food. Shameless plug again. So if you have an event you're trying to plan that's focused on health education and you need help funding it sometime in the next, I don't know, 6 to 9 months, feel free to let me know and I'd be happy to talk to you and see if you're eligible for some of that funding. It is reimbursement funding. So this is just some of my team. We do a lot of different events. We did a lot of back to school events. In the top corner, you can see Destiny. She did a career day. We've done several times at different school systems and levels of schools. So just trying to get people aware of health education as a career. We also do a lot with churches and other nonprofits. So if you have an event coming up, let us know. We'll try to do our best to be there and help give some health education information. So moving on into the data, we got data two different ways. We did surveys, and so we had paper surveys that we distributed to different organizations, took to all of our events. I have a list of that here in a minute. We also did flyers with QR codes so that people could scan them out in the community and do it that way. We also did focus groups. So just all the data overview real quickly. We had 32 people participate in focus groups, and then we had 403 surveys completed for Southside, which I was pretty excited about. It was actually more than we had for Pennsylvania and Danville. I think part of that is due to having incentives, and then we also did a shorter survey. Looking at ethnicity, you can see right there, we had breakdown, 61% was Black African American community and 37% was white, and then we had a small percentage of a variety of other demographics as well. And so just letting you guys know, this is just a very brief overview of our data. I'm working on the actual report now, and I'm happy to let you guys know it's published. So you will be able to see this again. So, right, this is just a quick overview of different places we were able to do survey distributions throughout Southside. We also took them to every event we did they were out for 2 months. And so we took them to every event we did within that time period. We emailed them out to different community partners, posted on our social media. So we did work with the Boynton Library, the Brunswick Health Ambassadors, Chase City Senior Citizen Center, SD Center, the Mecklenburg Department of Social Services, New Liberty Baptist Church, PADS, Rocky Mount Women's Ministry, Sela Center, Centero was a hospital system we worked with for this round of the community health assessment, and so they were a really great partner, and they also helped us get it translated to Spanish, so that was available as well. Same thing with our flyers. And then worked with South Hill Exchange Warehouse, the Southside Center, of course, the CSB and the Wellness Coalition, of our health departments, and we also worked with our WIC clinics, the Tabernacle of Zion, Tri-County, Washington Coleman, and then again our social media and events. So this is data from the surveys themselves. So the top 10 health conditions that people in the survey identified as seeing as a need. Sure, not a surprise to you all. We had alcohol or illegal drugs as a big one. So is cancer, and this was again just the top 10. So there were a lot more people could choose from. obesity and overweight, mental health, diabetes, heart conditions, access to healthy food, blood pressure, dental care, and lack of exercise. So looking at what people said were difficult services to obtain, so was hard to find within the community. The largest one was dental care, which I've talked to several people and have heard that's not a surprise to many. Mental health care was also up there, vision care, treatment for substance use, baby mother care, which I know is a huge need, urgent care, massage therapy, yoga, and cancer care, which is the first few of those. Again, I'll send some of this out later as well. So I can I'm going to send the PowerPoint to Jenna so you guys can look at this a little more later if you'd like to. And then looking at the barriers to care, so what's preventing people from getting the care they need. The biggest one by far was cost. You can see that on there. Huge number one lead, followed by time off and lack of providers, and understanding the use of services. You see health insurance and transportation is on there as well as location of services. And then our focus groups, we work with Southside Wellness Coalition, the Brunswick Health Ambassadors, and Tri-County Community Action Agency. We really tried working with groups that were already established so that we could just kind of come in and tag along to one of their meetings, because that makes it a lot easier than trying to pull together a group of different people and not knowing how many people show up. So those were great partnerships for us. Looking at the focus group, the key findings we got from those was maternal health care is brought up many times, as well as transportation, mental health care, substance use, and just resource awareness within the community. So looking at all that being said, I know we went through it pretty quickly, but does anyone want to come off mute and say how that reflects your lived experiences? Is any of this surprising to you? Is it pretty much what you expected?
From the veterans' point of view, it's pretty close to spot on in what we've seen around here. This is Dennis.
And Dennis, I will say one of the comments in the focus group was care for veterans. So that was identified as a need as well.
Yeah, I don't want to interrupt this meeting, but no, there is Kenan and Jenna and others know there's lots of things that we need to do as a community to improve our actions and how we take care of folks around here.
When we heard from the community, it sounded about like, what we heard even in individual events. So it pretty much, the information here really does line up with what we heard from people. It's just good to see it all captured in one place.
This is Catherine. Oh, and you can see can't see me. There we go.
It happens.
I think it was interesting that transportation was somewhere in the middle of the top 10, but when you looked at barriers, it was, I think, the third top one. So that stat is kind of maybe a little bit of an anomaly that needs to be looked at more. But that's what I saw. I always see discrepancies because that's where my mind goes. And so it being down lower on one end, but up higher on the lacking side. It's a concern, but it's really a lacking and a concern at the same time. So
yeah. And I think part of that is just because of what else it was listed with. So in the first set of questions, it was, saying what are the top issues? And there were a lot of just health specific concerns in that list. Whereas with the barriers, like I said, the cost was a big one, insurance access. So that was more specific to actually getting care. So I think that's why there's just discrepancy. But you saw it's also really highly identified need within the focus groups. So it's high in there on a couple of different slides.
And honestly, since the last probably couple years, I see that and I hear it over again when I was at Tri-County, when in the community with the veterans. Here where I'm working now, we have a non-emergency medical transport where we take people, there's a 3-month wait on
Wow.
taking people in the counties we serve to their appointments. Some of it is fee-based and all that. So we're trying to tackle it, but you don't see, it's almost too big of an issue for people to want to even try and tackle.
Yeah, I think it also is one of the things that comes down to having funding available, and people
Mhm.
are always scrambling to find that for many
Yep.
different things, and so many times it's issue specific. So
Yep.
it's a big need, but it's also a big need that, like you said, to try and tackle,
Mm-hmm.
especially because our counties are so large.
This is Danielle. With transportation, we've had clients many times call our local Heart Bus and been told they won't drive to Tri-County. We had a mom that was in need of diapers and she couldn't get here for that. And we had a free shop recently, and there was one family in particular, they couldn't get here because of transportation, so they couldn't get free supplies.
Fair warning, if anyone put anything in the chat, I can't see the chat right now, so I can look at that later too.
Yeah, there's nothing in the chat.
Okay, thanks,
I'll watch it for you.
I appreciate it. All right. So moving on, so after the community health assessment, we work on our CHIP, which is the Community Health Improvement Plan. And I hate big, long, wordy slides, but I thought this one was pretty good. And also, if you want to read it later, I'm just going to point out some of the main points on it. The CHIP process can look at a lot of different things that can include environmental health, businesses, economic issues, housing, land use, and other community issues that can indirectly affect the public's health, like transportation. And it's typically an ongoing collaborative community-wide effort. So the CHIP really is typically a community-led program or process. So with that being said, when we do the CHIP, the first thing we do is looking at our stakeholders and getting them involved. So we have prioritization of needs. So I'm going to have you all prioritize some needs here in just a second. From there, we identify the priorities and set goals based on those priorities that you all identified and form work groups. So again, my call to you all, my ask of you all to help me identify these needs. And then if you all want to email me, or Jenna can give you my contact information too, or if you want to work with, we can work at the coalition, but just we want to form work groups to look at these specific needs, and those work groups can help us identify the priority areas as well as some of the indicators they want to use to identify our progress in tackling those issues. So I have a QR code here. I'm gonna back out actually real quick and show you guys something else first. I'll put it back up in just a second. Share my screen again. So one of the other things I have created, again, don't judge my tabs, there's a lot, I know. Is we created this little one pager for the health assessment. That's kind of a brief overview, and I'm going to send it to Jenna so she can send it to you all. It just, again, has some of the biggest health issues, some statistics in there. It also has the insurance and demographics of who participated, as well as some of the just statistics that we got out of the survey as well. So I will share that as well, and you guys can look at that. You can distribute it, whatever helps you. Now I'm going to go back. Sorry, I keep flip-flopping. So I'm putting a link in the chat, and I also have it on my presentation if you want to scan it with your phone and do it that way. But this is there's a survey that'll pop up. Hold on, let me make sure it's open actually. I did not check that. All right, now it should be active. Sorry, guys. We get the QR code back up. Apparently I am a mess this morning. So this is the QR code. You can scan that with your phones. It is open now. You can also click the link in the chat, and it will take you to a list of 19 different needs that we have used. It's the same list I've also used for Pit Dan. And so if you can scan that and kind of rank things in the order which you think are the needs of the Southside community. And then I'll use that and kind of use it to kind of identify our top 5, and we can work on those as part of the chip process. But that's a huge help to us, and hopefully you all, if anyone wants to help participate in the chip process. And then if anyone wants to see any locality specific data, I'm happy to meet with you at a different time and go over that as well. We do have the data individually for Mecklenburg, Halifax, and Brunswick. But because for the report, we're doing it all as one, just as a district.
This is Kenan. Do you want us to share this one pager and QR code in the coalition newsletter?
Yes, please.
Okay.
So I'll send you, I told Jenna, I'll send you guys a PDF of the PowerPoint, the one pager,
Okay.
and then I'll also send you the link for the ranking system when we get off. And that way, if you guys could share it, that'd be great.
Okay. And how long is that going to be open? Do you want that on our table events?
I can it only, I have to change it. Only lets me keep it open for a week at a time. So
Okay.
I'll probably go in today and leave it open for at least another week.
Okay.
Hey, Brenna,
Yes.
it's not allowed. I'm in there right now and
Uh-huh.
it is allowing me to pick the first item, but when I go to pick the second, it says it's selected and then it deselects it.
That's weird.
Let me try a different item and see if it
So you
will.
should just be able to drag and
You
drop
actually,
from the top.
the way you take it and it's a drop, you pick
Yeah.
it up and
Oh,
you
you
move
have
it
to,
up.
So
oh,
drag and
okay.
drop.
You
Wow,
pick it
there.
up and you move it up to rank it.
Yeah, and you can move them back down, I think, if you will change your mind and want to move them around.
Absolutely. Yeah, you can
Okay.
move them around as much as you want, but it's a moving thing, not a clicking thing.
Well, yeah, that's kind of tough on a phone.
Sorry, Catherine.
Yeah.
Yeah,
That's okay. No, that's good to know because let me see if I can. Yeah. All right. There we go. Yep, that works. Thanks. Operator error.
It happens. I have my own operator errors this morning, so.
I'm moving mine all around. I keep
Especially
changing my
when there's-
mind.
Yes, especially when there's
Yeah.
not many, it can be overwhelming. But that's
Yeah.
the list we had used with one of our partners, and so just to be consistent, I've just used the same list because it's pretty comprehensive and a lot falls within those categories. So it's a lot, I know, but I appreciate the.
Oh, no, it's a fantastic list.
Can,
This is nice. This is nice to be able to really, in one spot, put, our perspective.
Yeah.
do you mind if we do this on another day, or do you need it now?
It only stays open for a week, so you can do it later, but just know
Okay.
there's a caveat to that.
Yeah, my mind doesn't work as fast as some of y'all, so I need a little bit more time.
Perfectly fine.
I'm with you, Dennis. Mine's going to be open for a little bit.
So I can see a couple people are still working on it, but in the meantime, I'm putting my email address in the chat. If anyone has questions or needs more data or anything like that, feel free to reach out. Or if you want to help me work on the chip plan as a work group. But that's everything I had to go over. So like I said, the survey or the ranking activity will be open, so feel free to do that later. We always just encourage people to do it at the presentation, A, while the information is fresh, and B, because I know a lot of times you'll say like, oh, I'll do it later, and then you totally forget to do it. So that's why I had included it. But thank you all for your time, and I really appreciate it. So have here if anyone has questions.
Thank you, Brenna, for that great presentation. I also have mine open, so I will do that after we finish this.
Thank you,
meeting.
Brenna.
Thank you guys for having me. I'm really appreciative to have the group. It makes it a lot easier. Shout out to Jeanette for being on my amazing team for collecting all the data.
Yeah, big shout outs to your team. You all did great work.
Does anybody have any more questions for Brenna? All right, if not, I'm gonna keep moving with the agenda. Next item on the list is the membership campaign. So I'm just gonna give you guys a quick update. We do have 45 members up to date, which means they've attended a meeting and also filled out a membership form. And 15 of those people are brand new to us this year, so that's amazing. In January, I'll give an update to about hours and events and all that kind of stuff. So be on the lookout for that. Next item on the list is going to be the ballot for 2026 leadership team. Kenan, do you want to share and introduce those people?
Absolutely. So we're super proud that we've got folks running for the 2026 leadership team. I'll go ahead and share my screen just for a minute. Certainly this information was in the newsletter that came out Monday. Our newsletter always comes out the Monday of the meeting so that we can make sure you have the information in the top of your inbox, hopefully. So we have three openings for the leadership team and returning members on my sharing my screen. We have folks running for the vacant seats that are coming available between Dr. Holzendorf, Kimberly Gordon, Dennis Damians, Deputy Kevin White, and then returning to our team, which we're super excited about for the second year, is Dr. Skylar Wells, Elena Martin, Jeanette Grimes, Catherine Maloney, and of course myself, who you can't get rid of. So with that being said, we wanted to provide the opportunity in our last meeting to allow folks an opportunity to share a little bit about themselves, in addition to the biographies that were sent out. The SurveyMonkey link is now live and active and will be live and active for you to vote. Again, if you are an active member, and you can always double check with Jenna on that if you're not sure about that. It will remain open until Friday the 26th. At noon. And then, of course, in that early week of January, we come back from the new year. We will send out a special blast in the form of a newsletter that will announce the folks who are now going to be governing the leadership team for 2026. So we appreciate everyone for that. With that being said, I wasn't here for attendance. My apologies. Running a little bit late this morning from my PT. Let's start with, do we have Dr. H available for a few comments? Yes, I see him. There he is. Welcome, welcome. The floor is yours.
It was a little late. I was dealing with a situation, but yeah, so my name is David Holzendorf. I'm the principal at Mecklenburg County High School, and I've been working very closely with Deputy White and the Sheriff's Department to try to help educate our students here at the school. We end up doing a lot of reactive education instead of proactive education. So we've been working very closely with the Sheriff's Department, but also with Kenan. And so my goal is to join the Southside Wellness Coalition as a member of Mecklenburg County Public Schools and Mecklenburg County High School to kind of help bridge the gap between community and our school. Mecklenburg County High School has 1,200 students, and we have 140 employees here at our school, and that's just on the high school side. So there's a great need for the resources and the partnership with organizations in our community. My background a little bit. My wife and I moved here in 2018 from Columbia, South Carolina, where we spent 11 years. When we moved there to get closer to Virginia from Georgia. So I grew up and was raised in Georgia, went to school in Georgia. And then we just kind of migrated this way. Her family is from Brunswick County, so we live just across the Mecklenburg-Brunswick line in Broadnax, Virginia. My background has always pretty much been in public education, 27 years, I believe it is, in public education. I spent 5 years as a financial advisor for Edward Jones, just because we really needed some flexibility with one of our jobs when we moved here to Virginia, and because my wife is an educator as well. So it's kind of hard to get away. Once you're in a school building, it's hard to get away to take care of personal matters. So I did that for 5 years and then missed it and came back to education at South Hill Elementary as an assistant principal and was named principal last year here at the high school. So that's a little bit about me.
Thank you. Thank you so much. Thank you. Kimberly Gordon, would you like to make some comments?
Hey, good morning. So 20 years in public education, high school teacher at Halifax County High School. I started, thank you, Shannon. I started back with the coalition in 2019, Kenan, I guess, was part of the leadership team way back then. Took a small break, finished my master's, got my educational leadership endorsement, and I'm back. Very, very passionate about all things safety for youth. I run multiple clubs here and they all have some sort of safety component except for the Honor Society. We do car safety with Yovaso, seatbelts. We do mental health. Jenna has been amazing and we have gotten the Youth Coalition going. Super excited about that and all the things. We started a partnership with our sheriff's department. We had our Hidden in Plain Sight event. I agree with everything that Dr. H was saying about being proactive, trying to catch it before it starts. A lot of my students are super interested in the trainings and in the things that you guys provide. At our last Youth Coalition meeting, we talked about Safe Talk, we talked about Revive, and they're eager for these things too. So I'm super excited. Our school should ooze community. So I'm hoping to help bridge some gaps, so to speak. So I'm happy to be here and I look forward to serving if chosen.
Thank you so much for your comments. Thank you. Dennis Damians?
Good morning. My name is Dennis Damians. I predominantly work with Veterans Affairs around here, worked with Kenan and others for a long time. We take disabled veterans from the Richmond VA, Durham VA, and Danville, which is the major clinic for the Roanoke Salem VAs, out on the lake at least a few times a year. We also take families that have special needs out on the lake. So our job is to really promote to get people to understand for recreational therapy, for just being out doing the rest. We have a lot of veterans in the area. We are an aging group, which has changed the dynamics and the demography of what is all around here. I'm also involved in a number of other activities. I guess, to me, in a nutshell, I appreciate the opportunity, but most of all, I just thank y'all for the opportunity to be able to participate with y'all, to help to contribute, and to, as everybody else has said, help make our community the best it can be. So that's basically it for me. Thank you.
Thank you, Dennis. Thank you for the comments. Deputy Kevin White?
Yes, good morning. I apologize. I'm in my car. I just left out of court this morning. But it's a pleasure to be before y'all today. A little bit about myself. Like I mentioned, I'm the school resource officer here at Mecklenburg County High School. I'm a community guy. I've been around since 2002 in some form or capacity, either coaching youth sports or mentoring our young people. As Dr. A said, I feel like him representing the school side and myself representing the sheriff's office, we have a great partnership within the high school building as far as being proactive, working together. I was fortunate and privileged to spearhead our Hidden in Plain site in Mecklenburg with the partnership with Mecklenburg County Public Schools. That right there kind of birthed more ideas and more opportunities to be able to reach our families in our area. As I said, I'm a football coach. That's access to another demographic, a whole other demographic of families. So, and I also have a before and after school program. So basically, I'm one of those guys that have my feet really in the ground in the community. Everything about the Southside Wellness Coalition kind of rings to my heart and my passion, far as just the overall safety and well-being, in our area. So I would be privileged and honored if I had the opportunity to serve amongst you all.
Thank you. Thank you so much. Thank you so much. So our 4 candidates have introduced themselves. Does anyone have any questions for any of the candidates? I'm dropping the Survey Monkey link in the chat box so that you're welcome to begin voting today. And again, it closes on the 26th. Floor is open for questions. Everyone's clapping. I love those reaction buttons. Awesome. So we certainly want to go ahead, again, allow folks that are returning to the team, again, to share a little about themselves. So we'll start with Dr. Skylar Wells, I believe is on here as well.
Yes, ma'am. Good morning. I'm an administrator here in Halifax County Public Schools. I'm currently at South Boston Elementary. We serve over 750 kids in our school. So it's really nice to have a very hands-on experience with many of our children with adverse childhood experiences. When I conducted my doctoral research study, I focused on resource parents, meaning kinship, foster, and adoptive parents, and their experiences caring for the educational needs of children with adverse childhood experiences. So it's been an absolute honor and privilege to work with and partner with Southside Wellness Coalition to better service our children in this area. And it's a privilege to continue to be a part of the leadership team.
Thank you. Thanks so much for that. We'll follow that up. Is Elena on with us today? Another member of our returning leadership team?
She was on.
She said she was driving, so it would come in and out.
Be mindful of our safety, folks. You don't need to be on here while you're driving. We'll come back. And then Jeanette Grimes.
Good morning, everyone. Thank you so much, Kenan and Jenna and the whole team. I'm thankful for the opportunity. I'm really happy to have been a part of the leadership team this year. I am grateful for all the opportunities I've had. And everybody said so many great things. And it's just good to hear. I have a master's degree in human services. I have been working in my community maybe a year after I got back from New Jersey, because I said I was only going to go to work and church and go home. But then, we looked at things that were going on. So from things that everyone has said, it sounds so great. But what I have to say is that I live in Brunswick County. Things are not going as great. I consider it a priority for myself and those I work with that there is work to be done here. Dr. H is just amazing. Mr. White, all of our team. And not that we haven't tried, but still in trying, it's like pulling teeth. But I could have been a dentist. I just want you to know. Okay, you got that. That's good. That's good. But still in our community, people, there have been suicides, there have been overdoses. There is still work to do, and I'm still pressing. And I love working with this group. I've even had family things to deal with this year, but even seeing there is work to be done. So we can make a difference like you all are making so many differences. I say you all, I say we, but there's still work to be done. And I'm up for the challenge, and I'm grateful to have had all these opportunities and still be able to kind of work my way in. Like Coach White said, that's a whole nother demographic when you're with another group where you can enter into that family a different way and have a voice and be able to share. So I'm here to share and keep working. And I'm just grateful for all the opportunities to do that, because since I'm still living, there's still work to do. I'm grateful. Thank you so much.
Thank you, Jeanette. Thank you so much. Catherine Maloney?
Sure. This is Catherine. I am the Chief Financial Officer at Piedmont Senior Resources in Farmville. Live in Charlotte County, have been involved in the coalition for the past probably 6-7 years. Got into it when I was the CEO at the Mecklenburg County Y, because wellness is a part of who I am, and bringing that wellness into the community was important to me. And all the things everybody's discussed, it starts with the kids. It goes all the way through, from the cradle to the crib, all the way down to the, where we finally rest, and making sure that people in our communities have access to the necessary resources. This coalition, I think, has been key in spreading the message, trying to prevent what we can prevent, and trying to keep people as healthy as we can possibly keep them by whatever means we all, have at our disposal. So I believe in our mission, and I believe each and every one of you who are running for this position would be awesome to have on the leadership team. I don't think there's anything more that can be said. We have some really good people on this team, and that will continue when the people churn off, because fantastic. And I appreciate each and every one of you stepping forth and taking on that responsibility of leading the coalition through the next year.
Thank you, Catherine.
Oh, yes. Thank you, Jeanette. From the womb to the tomb, from the cradle to the casket, I guess.
Does anyone have any questions for any of the members of the returning team? Any thoughts come to mind, thing you'd like to share? All right, with that being said, of course, as you know, the final member of leadership team is myself, and my prevention team at Southside Behavioral Health, which just got increased by another full-time position and half-time position as of yesterday. So we're super excited. Our job, of course, is we are the working folks, right? So we're a full-on volunteer groups. We are the working folks behind the scenes, minutes, agendas, documentation, looking for funding, all the ways in which we can support the really great works you all are doing. And as Jeanette said, much, much more work to do across our area, especially in Brunswick County. Lots of conversations we've been having around that. So lots and lots of work to do. So with that being said, if there are no other questions, again, reminder that the Survey Monkeys in the chat box is open and will remain open, and we will make an announcement. And of course, I know that regardless of the results, that all of us will continue working together and move forward in the Coalition 2026. So thank you all so very much. With that being said, the next item on the agenda is an update from Jenna about our our coalition's progress from Speak and into Mecklenburg.
Kim, do you have anything that you want to add for Speak? She might be talking. She may be teaching. So yeah, we meet once a month. Our last meeting, we had a guest speaker, which was Kadisha McCargo, which you all heard from earlier in the year. She talked about the mentor role program at Tri-County. We also talked to the youth about having a social media, so they decided on Instagram, and then also we're discussing Facebook, whether or not we're gonna kind of join with the peer mediator group and have them on a Facebook together, or if we have our own separate Facebook. They're also still working on their posted note campaign, so that's going really well. They have posted notes all over their hallways. There's 6 different hallways on these big whiteboards where they have put up motivational quotes, motivational little sayings that people can take during, the testing time and the holidays if needed. So a lot of those have been taken away, so they're kind of putting them back as needed. That is the conversation now is turning that into a yearly program where we kind of switch the theme based on the month. So sometimes it can be for suicide awareness, it could be for mental health awareness, or other things like that. So that's in conversation right now. Like Kim said, the kids are really excited. They want to do some trainings for the school and for themselves. So they want to know more about suicide prevention. They want to know about opioid awareness. They want to know about Revive training. They want to get their teachers knowing about ACEs. So those are some things that we're working on in the future. They did have 2 events in November, which we kind of reviewed. They did have VCU Project Impact come and talk to the entire school body about vaping and marijuana use. And then also, like we have been talking about, they did also help with the Hidden in Plain Sight, where I had about 12 of them come and volunteer, and they were ecstatic about that. So they were really excited. They want to continue that. So we're going to start having a youth portion to that as well. But that's my update for the youth. There's about 30 kids that are involved, but it's growing every time I go back. So, and I think Skylar's speaking next month. And that's what we're doing next. So we're excited for that too.
Awesome. Awesome. Thank you. Thank you. All right. The next item is leadership updates. Anyone on leadership team have anything they'd like to share?
If not, Kenan, I can share what we discussed at the TARP meeting.
Absolutely. That sounds fantastic. Christine was able to join us this morning, so that's a great time to do that.
Okay. So we had our final TARP meeting on December 16th on Tuesday. We went over kind of what they did throughout the year, so I'll just share the ending of that presentation real quick. Hang on. Can you guys see my screen?
Yes.
Perfect. Okay, so TARP went to 12 events in 2025. There was a ton of different types. So they went to Boyden Day, they went to a PATS event. They also helped bring some people in for the Creating Trauma Sensitive Schools Conference. They had about 50 people sign up for that. A lot of different things. So I'm just going to go over some of the work that they did. So we had 6 members of the leadership team. Chris went to 8 out of the 12 events. Kim came to 1, Denise came to 5, Skylar came to 1, and then Marianne came to 5, which puts them at all those different kind of hours. We also had pretty good attendance for our meetings. We had 10 meetings this year where Chris obviously came to all of them, and then everybody else came to most of them as well. So we had a total of, Chris Pennington did a total of 86 hours. Kim had 34, Denise had 30, Skylar had 8, and LaWanda had 7, and Marianne had 25. So we were just kind of going over all the great work that they did, kind of showcasing how much effort that they've put into the events that they went to and the TARP meetings in general. And then they're excited to be a work group of the Southside Wellness Coalition, and then Kim's going to be kind of heading that up. So we're excited to see what we do after that. So yeah, and Chris was our breadwinner. She got ACEs trained. She was the chair. She had 18 activities in 86 hours, which was amazing. And we'll miss her on the TARP leadership team, but she will still be helping out. She's not going anywhere. I won't let her. So
Awesome. And as you guys know, the reason that we track the hours and the time is that informs our grant applications. That's in-kind donation, right? The amount of time that you spend working towards a coalition is the support for us in terms of grant funding and applications. So we greatly appreciate all that the Trauma Informed Care Network work group did this past year. It's phenomenal work. All right, before we move to training announcements for the coming months, the floor is open for member updates.
Good morning. So this is Elena. I do have some COC updates. So for those who aren't aware, the COC is the continuum of care. It is our community response to homelessness in the community. Tri-County is the fiscal agent for our COC, and we have exhausted all of our funds for the fiscal year, which means that we do not anticipate receiving any additional funding until at least July of 2026. So if anyone is homeless in the area, if anyone is in danger of becoming homeless in the area, there are currently no funds available to assist. Also, we will be having our annual point in time count on January the 28th. This is a nationwide count where we try to count how many people are experiencing homelessness in our area. This impacts how much funding we're able to get in the future. So I will have an update, a more pressing update about that next month, right before our point in time count. But the highlight is that there is currently no ability to assist with anyone who is experiencing homelessness in the community.
Awesome. Thank you, Elena. We missed you earlier when we were going through the returning leadership team folks. Was there anything you wanted to share about yourself as a returning leadership team member?
Sorry, yes. I'm actually assisting with our Backpack Buddies program today. So I was helping unload backpacks out of a car full of food for elementary school students. So I did hear what Catherine was saying, and I just wanted to, I concur with Catherine. We're very appreciative of all the people who are throwing their hats in the ring. We really appreciate how many people are willing and wanting to help us advance our goals. And I'm just really looking forward to seeing what we're going to be able to accomplish in 2026.
Awesome. Thank you. That's a great way to wrap that conversation up. Thank you, Elena. All right. Anyone else? The floor is open.
Okay, so for the COPE project, we have we're currently doing our interviews with the people that have applied to be peer recovery specialists. That we have interviews tomorrow with all the people that have applied to be have applied to be in that program and be scholarshiped for that. That Kenan has kindly said that they will take an intern, which we really appreciate. We hired a director for that part-time, and we're bringing someone back from Texas that's a peer, and he'll be working for us part-time, but I think we need to find him more things to do around here so that we can get him. He actually wrote the peer recovery curriculum in Texas. So yeah, I'm really impressed with the quality of people that we've gotten for that. So we're very excited to be moving into that. Our peer recovery training will be in January, and then they will be going into their internships. So that is, I think, the news that we have from the program.
Great news, Shannon. Thank you so much for sharing. Anyone else?
This is Danielle, and the Infant and Maternal Health Coalition put together a free shop called Secondhand Treasures. We had an event in November 13th. Many of the partners were present. I appreciate all the help that you guys all do. We served 139 people. They shopped for 186 children. 66 children were under the age of 3 years. We had 9 new or unborn families receiving prenatal education and information. We had taken in over $17,000 worth of donations, and that was in the forms of clothing, shoes, some toys, some coats. We had such a surplus that we had this free shop on the 15th and 16th of this week, and we served 30 more people shopping for at least 40 children. These families were supported again with extra diapers, more education. 2 families received Christmas trees. I overheard conversations about hospitals not waiting long enough for the mothers to deliver and gave C-sections, which was an interesting conversation. But the good news is the WIC office had a flyer, so somebody was at their WIC appointment and saw the flyer and came to us. And also someone was at an interview at the YMCA and saw the flyer there and then came to us. It was wonderful. We also had Grillers for a Cause provide meals, beef stroganoff, so people were able to get some free meals as well. It was just, it's really good partnership. Our next big event will be April 18th, and there's no cost to have a table, so please just tell me. I'll put my email in the chat. Please tell me you're willing to help. Come, let's help support the mothers and women in the community. There was a request to have this maternal health summit in multiple locations. I cannot plan multiple locations, so if somebody wants to head up one for Mecklenburg County or Brunswick County, anywhere, we'll just duplicate the event. The plan is to have a panel of midwives, doulas, and mothers to be able to speak about their experience, and hopefully we can just get enough education and resources out to the community. Thank you all.
Thank you, Danielle. Thank you, Danielle. And that's something, certainly what you suggest, something the coalition could get behind if we wanted to help you sponsor that in other areas. So we will bring that up actually at our first leadership team meeting. Thank you so much. Next member? Or anyone else would like to share? All right, so moving on to events that are coming up. Moving into the new year, we are hosting 2 mental health first aids at the Southern Virginia Higher Education Center. Back up. We did host a youth mental health first aid December 1st in Clarksville at our location. And then in January, we were hosting a youth mental health first aid at the Southern Virginia Higher Education Center, which is now full, and people are participating in their pre-coursework and will be meeting me on the morning of January 5th. And then we also are hosting on January 9th an adult mental health first aid, again at the Southern Virginia Higher Education Center, which that class just filled 2 days ago. So those folks are now busy doing their pre-coursework over the holidays to join me and another trainer on that Friday, January the 9th. We are working on dates for both of those mental health first aid classes in February, March, and April. But if you know a particular location, particular place, if you're interested in a particular date to sponsor anywhere, please reach out to me. We are going to be trying to lock in some public facing classes as well as the ones that we're doing privately for folks. In addition, if I get my flyer, where's my flyer? We are hosting we're announcing our next 6 month of virtual revives, which is, of course, the class that we provide once a month virtually. We did our final class yesterday for 2025. This is when folks are needing the revive training and do not have the opportunity or the convenience to attend in person any of our revive trainings. So we offer this lunch and learn throughout the year. Where is it? There it is.
Our next one is January 21st. It's a Wednesday.
Yeah, thank you. I know your patience. I know my patience running thin on me too. I had too many windows, too many tabs open. Jenna has like 45 tabs open on her computer. I can't do it.
That's what me and Brenna were literally talking about just a few minutes ago.
But Kenan, don't be judging our tabs. That's in a safe place.
I didn't mean to. I didn't mean to. I just can't function with that. I'm like, oh my gosh. And I'm looking for this flyer. Anyway, so as you can see, we've got the 6 up and coming lunch and learn. People can be trained in revive. As I just did yesterday, we deliver materials to folks within 3 to 5 business days, or they pick them up, whatever they choose to do. But as always, you know, this training is available in person, anytime, anywhere. Just reach out to us to let us know. Also, I don't have a flyer for it yet, but we are days away from securing the prizery for May 21st for our second annual SMBF Mental Health Summit. So I know Dennis knows I'm going to be coming after him and other folks. We'll be creating a work group in January, inviting folks to be a part of the planning. We do want the outreach that we did with that to go above 100. We'd like to bring in up to 250 people this time to the prizery. Again, May 21st, our second SMVF Mental Health Summit. If you're interested in helping us, we are looking for volunteers for that work group. All right, and that, I believe that's all I have. Jenna, is there anything else we need to announce for up and coming?
Nope, I think that's all of our trainings and events. The Southern Virginia Problem Gambling Summit will be in June, and it's going to be June 17th, so save your dates for that as well.
Yes, and these flyers are going to be on our social media as the new year rings in. We'll be sharing flyers and such, putting them in the newsletter and such. Our next meeting is the hybrid meeting, so we'll be back where you can come join us in person for cake and coffee and snacks on January 15th, beginning at 10 a.m. We will be hosting our meetings here in Clarksville at Southside Behavioral Health and online, of course, at the Zoom. Any final questions or announcements?
Thank you guys for all that you do. I think you're awesome.
Thank you. We appreciate it. We appreciate all of you, and have happy holidays, Merry Christmas, Happy New Year, whatever you are celebrating in the coming weeks. I hope you have good health and take good care of those that you love and care about. And that you guys are in the helping industry. We're helping people every day. Please continue to do so. Thank you all. We'll call the adjournment at 11:08. And thank you, thank you, thank you. Jenna, I'm going to save the chat before we shut down.